Hi, today's topic is about migraine during pregnancy. So, what is migraine? Because of some chemical changes in the brain, there will be difference in blood vessels. It dilates, it constricts and suddenly it dilates. Because of this change, it precipitates a headache. This headache, usually it is one-sided, it will be severe and throbbing, and usually it lasts for 1 or 2 days, and it will be associated with vomiting and eye changes also. So this is a common presentation of migraine. So why I have taken this topic of migraine during my pregnancy is that usually when a person gets migraine, we have so many medicines to prescribe. But during pregnancy, all the commonly used medications for migraine, all these are contraindicated. Means it should not be used because it can harm the baby. That's why. So we are going to see this topic, specifically the medications, and I'll tell you what are the drugs, the usual drugs which is given and the usual drugs which has to be avoided. See, when a pregnant lady, she gets an attack of migraine, so it is best that you go into any room on your house which is silent and be in the silent room, and you sleep off. And it's better that you blindfold your eyes and keep a cotton in the ear and have a tight handkerchief or towel tied around the head, so that all the sensations are cut off, and this handkerchief tied will help you for relieving the headache. And if the headache is severe, you can apply ice on that particular area also. That also will give you some soothing, will give you a relief. So if you can take tablet paracetamol or Calpol or Dolo, it is better. So you sleep off, and so that you have a better day, the next day is going to be normal for you. So this is how you manage an acute attack. But in case it is severe and you have associated vomiting and you have vomited multiple number of times, then you have to go to some center where you can get an IV drip, and along with that chlorpromazine and paracetamol injection also. Usually this will take care of acute attack. Normally, when you get for a normal person, when he gets a severe acute episode of migraine, we used to advise ergotamine tablets or any triptan group of tablets, like sumatriptan, zolmitriptan, forvartin, like so many drugs. All these drugs are contraindicated during pregnancy. It has to be avoided because it has not been completely tested, and some studies show that it may have some side effect in the baby. Now, for prevention during pregnancy, prevention of migraine during pregnancy, the commonly used drugs are either it has to be propranolol or it is metoprolol. These are the two common drugs, and these also can be given only the first 2 trimesters, the first 6 months of pregnancy. It's better that we avoid during the last trimester because it has got the side effect increases. And for prevention, even magnesium and tablet riboflavin also can help. Usually for prevention, we used to give flunarizine, which is sold under the name of Cybelium. So there are some controversies about that, and it's better that you avoid all these medications. So the safe drug for prevention are propranolol or metoprolol. Now this migraine, the person who's suffering from migraine, when the person becomes pregnant, usually the headache because of migraine, it comes down. Why? Because the estrogen level increases during pregnancy. That's why. And after delivery, the episodes of migraine recurs. But sometimes what happens, they experience the first migraine headache during pregnancy. Even that is possible. Now, migraine headache can be precipitated because of so many causes. So if you can prevent all these causes, you can prevent the episode of headache. So let us go through the list of triggering causes. One is stress, strain or tension. Then you're not getting a normal sleep. Even that can precipitate. Watching TV for a long time or over the phone, or watching phone for a long period. Likewise, you're always on empty stomach, you're not able to eat properly. You're not taking your food at the right time, and you are dehydrated. Likewise, your intake of chocolate is more. So better to avoid chocolate, coffee, cheese, butter, deep fried foods, onion, soya sauce, likewise excess of pickle and alcohol, and other two common causes are bright light and excess of loud noise. Even that can precipitate migraine episode. So all these triggering attacks, it's applicable even for a normal person. So same thing can be there for a pregnant lady also. So if we can prevent all this, you can prevent an episode of migraine headache. So that is all about migraine during pregnancy. Thank you so much.